the chest wall bone, we call them as sternum. This is subcutaneous, that means it is lying below our skin, easy to feel, clinically important to identify this particular different parts of the bone, and it has got number of like joints, which is important and relevant for us to understand. Now this is a flat bone, as you are seeing here, these bones have got different textures, different lengths. These are kind of like long bone. This carved, which is clavicle, but this is a short bone, right? The short long bone it can be called, but this particular long bone is not ideal. That long bone we have learned that in superior extremity classes, which is upper end, shaft, lower end, which has, this has medial end, lateral end and shaft in between. So we call them as miniature short bone. This is a kind of like long bone as well, but this is carved. Likewise, this bone is flat, so it has a flatness which is helping us to grab this bone if it is required for doing any procedures. So this particular bone have got three parts: upper part, middle part and lower part. So upper part, which is kind of little bit expanded, star shaped. Lower one is kind of like looks like a bar piece of bone which is there. Together, if you just like join them, it looks like a dagger. And the lower part which is missing of this particular bone, often this things moves away whenever you are separating this bone, because it has a tiny small fragment. We call them a Xiphoid process, which is we are not seeing. So this particular bone needs a little bit visual understanding. That's why we placed it for these classes. So this is the midline bone we are studying here. So this part is Manubrium part, then we have the body, then you have the Xiphoid process, three parts of this, and you can see that there is an anchorage of this particular carved long bones which is present as ribs. They are joining on this particular bone, and grouped in here is presence of these blue line, we call them as cartilage. This cartilage related to the ribs, we call them as costal cartilage. So this costal cartilage have got like two ends. One is fitting with this particular bone which is the sternum has, which has the lateral sides, and this one is fitting with this costal end or cartilage end of these ribs. So this piece of cartilages is there. They are maybe isolated present, they have maybe single presence like this, or maybe they are joining together, making and uniting with this lower end of the clavicle, lower end of the sternum, depending on where this particular bone is. Now these piece of bone are separated and they are joined with each other, like this one, this one, this one. So this particular union point between this upper end and the middle portion is important for us, this point. This point we call them as manubriosternal joint. Manubrium with sternum body which is joining here, manubriosternal joint. This is also known as the sternal angle, which you have referred so many times, also known as angle of Louis, which is a important landmark point for doing clinical examination. This is most projected part of the chest wall in the this particular point. If you just like roll the fingers on the side of it, we just like see that there is a elevation at point. That elevated part is basically you are filling out here. So this is most prominent part of this sternum or Sterno-costal joints that we have. So this particular region helps us to guide to count the ribs onwards. So we count this one as a second rib, and then we go down third rib, fourth rib, so on, and move up, we get this rib one. So counting of the ribs begins with this sternal angle joint, what's taken costal cartilage, which is present at the sternal angle. Now this particular bone, as you are seeing here, is a flat bone which is present in here, joining over here. Now point of concern for us is the joints which is present in here. So how many joints you are seeing in this particular picture, whichever you are referring here? How many joints you are seeing in here? You don't have to count 1, 2, 3, 4 like this. What are the different bones are uniting over here and making a joint here? Sternum with clavicle. Sternum with clavicle, we call them as Sterno-clavicular joint. This one, then Sterno-costal, that means this one and this one. Okay, and what else? Sterno-manubrium, this one. Then Sterno-xiphoid, that means sternum body with this xiphoid process we have in union as well. So we have different kinds of joint coming over here, making these different joints over there. That's why joints related to it is important. As well, we have to consider this particular joint as well, which is present in here, this one. So we call them as ribs joining with the costal cartilage. So these are the different kind of joints we are addressing in this particular picture. We have to know different names which are present in this particular pictures, like Sterno-clavicular joint, which is present in here. Then we have this particular costochondral, that means joining with the ribs with this region with the costi, we have the costo-chondral joint. And then we have this particular sternum with this costal, this ends or this ends which is joining over there. So we have to know what are the different types of joint which is present. Some of, not all the joints are identical or similar kind of joint. So for example, Sterno-clavicular joint, we have a separate class for these, like in upper extremity. If I have not done, in the thorax we will be doing some point. The Sterno-clavicular joint, what are the different types of joint present in this related to the sternum with this particular clavicle, and what different types of joint it is there, like a synovial joint which is present over there, planar variety, and it is separated by two cavities. We have a disc present in it. That's why we call them a Sterno-clavicular joint with two separate joint disc which is present in it. This particular joint you call them as Costo-chondral Junctions. So that means this one, this point. This particular point we have this union between this bone with the cartilage taking place, and this is not mobile type joint. It cannot be moved over there, this joint. Now, having said that, this is a delicate tissue compared to the bony tissues. The cartilage is always delicate. So this union point where the delicate part meets with this particular bony part is always have a trouble, because this particular bone tries to overrule over this cartilage small part. So there is always a friction or kind of fight is going on in this particular joint. So these particular joints are prone to have inflammations, and this particular inflammations in this particular joint we call them as costochondritis, which is inflammation of costochondral joints. So costochondritis joint presents commonly with the chest pain, and if you press on these particular joints, it is very painful. So this particular thing, which is very clinical, frequent visitors will get, like presenting with costo-chondral joint inflammation, costochondritis, then coming with this Sterno-costal joint, this sternum with joining over there. So there are different types of joint which is making between the first and second costal cartilage with the manubrium, which is immobile, whereas the second one which is making in joint junctions over there, which is a sternum with this particular part, which is little bit mobility or mobility is there, which is second costal cartilage with the manubrium with the body of the sternum. When this is joining away, there is a little bit mobileness is there, because we have this particular joint union between this sternum which is joining with this particular bone with this body of the sternum, taking little longer time to make this union. Then third, which is having a third to 7 over here, we have isolated bones, third to 7 costal cartilage joining with the lateral margins of this particular sternum body, which is making this particular joint, which is relatively immobile. And beyond that, which is like a 6, 7, 8, 9th and floating kind of, except this floating ribs, they join together along themselves by the cartilage, and then eventually they join over here. So they join each other with themselves, then they join as united point to this particular xiphoid process or edge of this xiphoid process and sternal body junction. So these are the different types of joint which are present in this particular thing. So sternum bone is a kind of having complexity based on this particular joint. So you have to memorize this particular facts, not detail of it, but you should be knowing the different compositions, factions which are present on it, right? Apart from that, this particular sternum is a point of clinical important thing, because this is an accessible bone. As I have mentioned, we can easily grab this particular bone to do a bone marrow biopsy. That means we have to do some study of the blood cells production house. That means blood is produced from this production house, we call them as bone marrows. That means RBC, WBC, platelets, whatever we have coming from that bone marrows. So if you are having some blood disease, we have to exclude that particular bone marrow is producing some kind of good objects or not. So for that, the blood disease, we have to go to refer to the bone marrows. For example, a person is suffering from the blood cell disorder, we call them as leukemias, which is a cancerous conditions for the blood cells. So for that cancerous cell, we see the cancerous leukemic cells present in the blood, and as well as we have to see that this cancerous cells is coming from the bone marrow as well or not. So we have to confirm that. So we have to do a bone marrow biopsy. For that, we choose this kind of flat bones, especially the young adults. Whenever you're doing, as we have to be super careful doing the bone marrow biopsy if we are doing for the young kids, because they are thin bones. If put too much pressure on it, it cracks and it breaks the structure which is present deep to it. That means it will end up in a mediastinum, and you will end up in mediastinum. We see that there are a number of structures which is present, series of it. You can damage any and every of them, then that will be a life threatening condition. So we do not have backup for this. So this is another bone, flat bone. We take it like hip bone, where you are going to learn hip bone in lower extremity patients. So this particular slide is particularly important for me because this particular joint brings us so many of clinical problems to us. Now talking about this particular joint between this particular manubrium and the body, we manubriosternal joint, which is a point we call them a sternal angle, angle of Lewis. Now this is intervened by a cartilage which is present in here. This cartilage unites at the age of nearly 60 years. We may not live that long. That's why we get this particular thing separated. No, not for you. Maybe I'm talking about myself. Maybe I not be living that old to get this particular thing ossified. Similar to that, the body united with the xiphoid, which is uniting at the age of late 40. Hopefully, I have united this particular part, completed this. At least when I die, I have this part united. It's not separated. So it takes longer time to unite. This is a kind of joint. We call them a secondary cartilaginous joint and primary cartilaginous joint. That primary cartilaginous joint becomes ossified eventually at the end of this. So this kind of joint, we call them as cartilaginous joint. We call them as primary cartilaginous joint, which eventually at some times unite, becomes bone, becomes a single bone. And if it is not united, separated, remains separated, we call them as secondary cartilaginous bone or secondary cartilaginous joints. So this is what we are referring at. Three pieces of bone together, manubrium, body, sternum and xiphoid process. The manubrium upper part opposite to the vertebral level, it is there. It has a notch over there, we call them as jugular notch, which can be felt as well. Deep to the jugular notch, if you press too hard, you are going to touch the trachea. If you press too hard, you are going to touch this trachea and choke it, and it will create a reflex, we call them as cuff reflex. So ask the patient to extend, and then you in the midline on top of the jugular bone, if you are touching something, that's a trachea, and the tracheal position we have to assess whether it is present in the midline or right side or left side. In physiology people, they will just like guide you to learn to identify the positions of the trachea over this notch. So again, even if we are studying physio or biochem, I will be pitching in with anatomy. Without this, you cannot survive. No matter how big you reach to place, if you are in this business of medicine, surgery, gynae, everything, you have to come back here, this point. So again, this particular region we call them as xiphoid process, and this particular landmark in this particular skeletal individual, we have to do this point, jugular notch, sternal angle. So again, counting of the ribs. So physiology people need us to do this counting of the ribs, counting from the sternal angle. How to find this? This is a point where it is most bumpy thing which is visible. It is only palpable visible thing. Some of the skinny guys have these things visible. These things are bulged out, really bulged out. They are visible. Some of them you have to roll the fingers by the side. You will see that from depressed part you are going in an elevation. That means this is the elevated part, sternal angle. Then you count this rib as second rib, above first rib, third rib, fourth rib, like on. So this is how this particular sternum and the part of the sternum matters to us, starting with the joints and starting with the bodies. So this particular body has got like the middle piece of things which is present between the vertebral levels. We do not have to worry about. It articulates with this particular costal cartilage, that means on the sides the ribs are fitting in. This particular borders of this particular thing we call them as lateral border. This is the anterior surface and the posterior surface in the back side. This thing has got jugular notch on the top, easy to identify the superior and inferior. Inferior one uniting with this and jugular notch present on the superior aspects. The lateral which is present with the facets, we call them as costal facets or facets for the cartilage which is fitting with these ribs along with it. So this is how these particular bones are placed, and xiphoid process, fat cartilaginous process, unites after middle age or close to this 50 years age. Over this period we have this sternum united over here. Now talking about the muscles which are present on it, anteriorly and posteriorly. Easy to remember if you just like have seen these dissections in the upper extremity. We have seen a large muscle chunk over here, we call them as pec major, right? So this particular pec major take a bulky attachments over here. So all this over here including the manubrium, body, and bypassing the xiphoid process, we have this pec major attaching or pectoralis major attaching on here, encroaching to this costal cartilage, little bit of it, and then this side as well, other side pectoralis major, which is present. Important to us is this particular attachments over here. Close to this particular jugular notch, along with this attachment point of the clavicle down there, we have a muscle attached. We call them as sternocleidomastoid. In short, we call them as SCM. We call it SCM because by the time we pronounce the whole name, patient dies. So that's why we make an abbreviation of it. Sternocleidomastoid, patient gone. So we have called them as SCM, which is going to the neck. So this particular muscle is prominent over here, anchored to top of this manubrium over here and fitting on the neck. On the back of the neck, behind the ear, we have the bony process. We call them as mastoid process, which can be filled as well as a is subcutaneous bone. Don't poke too much for the specs guy, because your eyeglasses will be falling. Careful with it, right? Because your eyeglass lid is falling on the ear. So this particular bone is mastoid process. From here, it is anchoring to the mastoid bone. That's why we call them as sterno to mastoid, and in between it is coursing through the neck, which is known as clado. So sternocleidomastoid. So sternum to mastoid passing through the neck, we call them as sternocleidomastoid. So these are the two pieces of muscles which are important for us to remember in the anterior half. Posteriorly, we have two pieces of muscles which are related to the manubrium side. This one. So this particular region, we have two muscles present on this particular point. Now this particular muscle goes by the name of the sternum, and they go to the front of the neck. So we have a neck muscle which is in front of our neck. We call them as strap muscle. Strap means they look like a ribbon, strap. That's particular strap. So this particular muscle, we call them a strap muscle. Two of them are anchored to it. We have altogether 4 ribbon-like muscle in front of neck. We call them as strap muscle or ribbon-like muscle. This strap muscle starts with the sternum and ends in some point in the larynx or voice box cartilage or voice box bones. So we call them as these muscles as sternum to thyroid. We call them as sternothyroid. It's coming from sternum to bone, which is known as hyoid. We call them as sternohyoid. So this particular muscle looks like ribbon, flat muscle in front of neck, covering this particular gland we have here. What gland we have here? Thyroid, right? So covering the thyroid gland, we have these strap muscles covering here, running between the sternum to hyoid, sternohyoid, sternum to thyroid, hyoid and thyroid. These are cartilages of our voice box or larynx. So we call this muscle as a strap muscles or muscle stabilizer. Apart from that, we have close to the xiphoid process this red strap tissues which is present. This is the xiphoid process, and lower end of the bodies of the sternum, we have these particular attachments over here. What muscle attaches here? We have a muscle going to the abdomen, anterior abdominal wall. Just like we have thoracic wall, we have the anterior abdominal wall. Now this anterior abdominal wall, we have a muscle, we call them as rectus abdominis. Rectus. R-E-C-T-U-S, rectus abdominis. That means a muscle which is present in the anterior abdominal wall. The word rectus means, the word means as straight. So it's a straight abdominal muscle present in anterior abdominal wall. We call them as rectus abdominis. Now what's important or what's funny about this rectus abdominis? It has a segmental appearance. That means this muscle are not an entire piece of length which is an entire muscles which is present. It is segmental. That means it is a small piece, cubical things present in between. That means it's between the muscle, it has tendons and they are joined to it. And this particular muscle, we call them as the pack muscle, which is famous for it. We call it 6-pack muscle or abs muscle, 8-pack muscle, that pack muscle. We don't have it because we have fat packs. So those muscles who have this particular really strong fat muscles, this particular flat muscles, if it is contracted and devoid of fat, they appears with the flatness with these small pieces. That's why they look like flat muscles. We call them as pack. So that particular ab pack muscle is nothing but the rectus abdominis. That's rectus abdominis muscle. Upper part is attached to here. Lower part is attached to the bone of the hip region. We call them as pubic bone. So it's a flat muscle running in between from this midline sternum to the all the way to this groin over here. We call them as pubis bones. So between it is running. So it is flat muscle. This muscle we are going to see when we are going to do dissection in the lower abdomen or abdomen dissection class. So these are the important thing. We have to remember this muscle, pec major, This one very important, sternocleidomastoid, because we tag these muscles for examination. Pectoralis major we do not tag it because it is a very superficial obvious muscle. More or less this muscle can be called as subcutaneous muscle itself because it is a very prominent muscle. The sternocleidomastoid also very subcutaneous. This is exam high yield tags we have, and these flat muscles also we tag it for examination. We do the dissection in the neck region, we find this particular muscle present, sternohyoid and sternothyroid. We know the name and we forget about the name, no worries, but we cannot forget about this one, sternocleidomastoid. Alright, so these are very important for us to identify and remember this. And these things, cutting the sternum, we have to do a surgery, we call them as median sternotomy. You split the sternum open and then we go inside to the sternum. We have the rib retractor that retracts or spreads the rib and do the surgery, bypass surgery. We are talking about the bypass thing or grafting, the arterial graft, we are talking about picking this particular thing. So, deep inside on the side of this particular sternum we have a long artery running, we call them as internal thoracic artery. This artery we clip it here and take this artery and put it to the create a bypass on the cardiac tissues or cardiac vessels or between the coronary arteries. That is why it is present in there. So, strip it off and take it out. We take it because we have other blood supply to supply this intercostal space. So, that can be spared to keep this person alive because it have a graveness of the disease if you have scanty or less blood flowing through the cardiac muscles. So, this particular element regard to this particular thing which is sternum is concerned, we have to know. Other thing is that you have to identify this piece of the sternum, bodies of the sternum and the xiphoid process if it is there. If I find somewhere the xiphoid process isolated, we can bring it out. These are neural bones. In the artificial bones, we do have this particular xiphoid process. So, we bring this particular real bones for identification whenever we are identifying. Now, how to identify the anterior surface and the posterior surface of this bone? The anterior surface is rough. Why it is rough? Because it has the rough muscle attached to it, bulk muscle attached. What bulk muscle is attached? We have pec major, which have sternocleido. That is why this side is rough. Compared to this inner side, it is smoother. So, easy to feel with this with your fingers. If you place over here, this roughness is giving for the crafting or attachment of these thick motor muscles which is present. This one we do not have much of strong muscles. We have the strap muscles which are really thin muscles present in inner side, and rest of these are smooth, do not have any muscle attached. So, this is rough which is present in here, and this particular element gives attachment to the clavicles and the costis accordingly. So, the clavicular part attached over here. This side is little bit like a deformity which you are seeing here. The clavicles, the sternum may have some kind of deformities. You may have split of sternum, you may have the half of the sternum present, we may have this particular notch not properly formed, we may have some kind of structural bony deformity of the sternum. So, excluding that, we appreciate the sternum is a healthy, normal, identical and ideal bone whenever you are studying. So, this region is that notch we are talking about, the jugular notch which is present, and the clavicle is fitting over here, and this ribs which is fitting and second rib which is joining at this particular point. This region which you are seeing here is the costi or the rib attachment part, right. So, which is present in this region. So, you have to find this particular lateral extremities. So, you see that rib 2 partly attaches to this particular bone which is the manubrium part here, and half of it attaching on the body. So, we have a half facet here and half facet here for the attachments of the rib number 2. So, likewise, if you just have a close look, you see that this particular end is joining with this particular body of the xiphoid, and this one on the side we have this half facet there, and other facet is there with this sternum bone. So, this particular sternum in this side we have these particular fascians. Yes, we have this half facet present and on the side as well. So, for the attachments of the rib 2. So, whenever you are given in the examination this particular joint, you have to identify manubriosternal joint which is present uniting at age of 60, this one, and this one is late 40 or 50 year age uniting together to make these things, becomes primary cartilaginous. Before that it has intervening cartilage, then we call them as secondary cartilage. And these are the lateral margins where you can see this particular costal facets for the attachments of the ribs or costi cartilages which is fitting in here, and what kind of joints they are making, that is the next question they are going to ask, like cartilaginous joint and what kind of mobile or immobile, etc., etc. And clavicle, of course, it is important to us whenever you are studying the clavicle, this sterno-clavicular joint, you have a ligament attached to it. So, sterno-clavicular ligament, interclavicular ligament, they are the kind of ligament which is binding there, and this particular thing has a cartilage disc in between, splits this particular joint, synovial membrane covering into two chamber joint or two member synovial joint, which is little bit of concern, but not much of concern for undergrads at least. So, you should be able to identify this particular bone whenever you are identifying this, which is manubrium, which is what, and muscles attached to it. All the bodies which has got only muscle attached on here is the peak major, and the lower part of the body may be encroaching here. A straight muscle from this abdomen is coming, we call them as 8-pack, 6-pack muscle, right? We call them as rectus abdominis, which is coming from midline and going, right? Good? You want to run away? Go. This is your time.